Our Asthma Care Coordination Program is a program where we concentrate on children with high-risk asthma. We have certain criteria that they meet, and we provide extra services to that patient population because what we realized in taking care of them is that although their asthma is a concern, they also have various other barriers, and they need some assistance with those barriers before we're able to actually help them improve their asthma.
Things like inability to access and use medications, environmental barriers to care, families' ability to self-manage.
Some of those things can be housing issues, transportation issues, not being able to get to clinic appointments, but also not being able to get to the pharmacy to pick up medications. So one of the things that we offer is a pharmacy delivery service.
And by having the care coordinator to be able to be that connecting piece has just been awesome. It makes such a difference. You can tell when the families walk in, they're comfortable, they're not worried or concerned about being in our facility or being at the primary care visit, and they're much more willing to take recommendations that we suggest for the asthma in general.
We choose children, obviously they have to be a patient in one of the 3 primary care sites, and they have to have had 1 hospital admission or 2 emergency room visits in the past 12 months.
As well as currently they have to have Hamilton County Medicaid and be between the ages of 2 and 17 years old. There's really a much larger emphasis on the social aspects, and what we have found in working with our population in particular is that until you meet those basic needs, you really can't address the healthcare issues. When we initially were beginning with Marcus, his asthma was not very well controlled. His mother was completely overwhelmed with life in general, as well as having 2 children with asthma and the difficulties that that brings within itself.
Yolanda, I don't think Lala's ever been admitted to the hospital for asthma, but been to the emergency room. But Marcus has been admitted a fair amount of times. Can you tell me kind of what that's like to have him be admitted to the hospital?
It's not fun at all. I'd rather for him to be like he is now. He's doing a whole lot better with his asthma.
I had to slow down and stuff. Now I know when to slow down and how much of my medicine that I have to take.
How do you help your sister with her asthma?
Whatever she don't know how to do, I show her and tell her.
He helped me take my nasal spray, my Q-bar.
Our care coordinator was able to make that relationship, build that to the point where Marcus and his family feels very comfortable now calling Brandy to say, hey, we're having problems, or we're not sure, we have questions.
I think I have a great relationship with the family.
I think the care coordination program that we currently have with our asthma patients is different than care coordination in other facilities. It's not necessarily scripted. It's very patient-family individualized and meets the needs of the patient and family and not our needs as the health care provider.
At the beginning of the program, most of these children would use the emergency department or get admitted once every 173 days. We were able to extend that to about 325 days.
We've had about 443 patients ever enrolled in the program. There's about 215 currently enrolled across the 3 sites. And because we do follow the patients for so long, we have a good understanding of what were the last 6 months like for this family and why are they here today. Both of my children have now also been diagnosed with asthma, so I live it every day and can very well relate to what the families are going through. To have someone that is familiar with their story that can put all of those pieces together, I think is very helpful for the families that we work with.
It's more than health. We want to help patients and families be better overall, and I think that care coordination is a great step to do that.
It really did help us a lot. They don't have to be rushed to the hospital. They've been in the hospital for a while, so it's good.
What are your hopes and dreams for the future?
Play basketball and be on TV one day and be the best at it.
What do you want to be?
A police officer. Or a firefighter. Or a teacher. Or a princess.